All right, good evening, everybody. I am very happy to be here tonight and to welcome everybody. I want to introduce our event. Welcome to our event, the Symposium Our Lives Depend on It, a Dillard Symposium on COVID and Health Disparities. My name is Dr. Amy Lesson. I am an associate professor in the Minority Health and Health Disparities Research Center at Dillard University. I'm just going to say a little bit about our center, and then I'm going to introduce our speaker for this evening. The Minority Health and Health Disparities Research Center at Dillard University here in New Orleans is a research center funded by the National Institutes of Health that was started in 2012, and we're dedicated to improving the health of underserved populations in New Orleans and the surrounding regions. And we research health and healthcare inequalities among races and people. In addition to conducting research, which we do at the center informs the public and holds events that address health disparities in communities. And I'm here with my colleague, Tiffany Kirkwood, who is our coordinator of programs. And we're very happy to have you here tonight. And I would love to introduce my speaker for this evening, Dr. Benjamin-Robinson. Welcome, Dr. Benjamin-Robinson. Thank you so much for being here. So let me just tell everyone a little bit about you, and then we can go ahead and get started. We're going to have a little bit of an unorthodox keynote speaker this evening. Instead of a talk, we're going to have a conversation. So I'll introduce our speaker, and then I'll ask some questions, and we will have a conversation, and then we'll open it up to questions from you through the Q&A or the chat, but I think probably the Q&A is the best place to do that, and we'll get into that in a moment. So I'm really, really pleased and honored that we are joined tonight by Dr. Earl Nupsius Benjamin-Robinson. Dr. Benjamin-Robinson is the Deputy Director of the Office of Community Partnerships and Health Equity at the Louisiana Department of Health here in Louisiana. He leads, develops, and oversees health equity and community partnerships efforts that support Louisiana's health and wellness, while he also leads efforts intentional in creating fair and just opportunities for all people to reach their full health potential. In 2019, Dr. Benjamin-Robinson led the development of the first agency-wide health equity plan at the Louisiana Department of Health, and it's the first plan of its kind in a southern state. He is a public health practitioner with over 18 years of experience. Dr. Benjamin-Robinson is faculty at Xavier University's Public Health Science program, and since 2015, he's been distinguished by the American Psychological Association as a health equity ambassador, and is a practitioner, scholar, member of the Health Disparities Education Awareness Research and Training Health Equity Scholars, and is a co-founder of the Bach Group, a population health consultation firm. So welcome, Dr. Benjamin-Robinson, and thank you so much for being here.
Thank you so much for allowing us to do this via a conversation. I really appreciate that.
Yeah, I appreciate it. I think it's a really nice format. So I just wanted to, as a preamble, the reason we really wanted to have you speak tonight is that at the Minority Health and Health Disparities Research Center at Dillard, we really have a health equity lens in the way we look at health. And we all know, I think everybody here tonight realizes that in addition to being a global health issue, especially here in New Orleans and in the state of Louisiana, it's become into clear focus what a health disparities and health equity issue COVID-19 is. Mm-hmm. And so one of the things I was really wondering is, from your perspective, from your position as a Louisiana State Health Department person who really thinks and directs the programs about health equity, can you tell me how the COVID-19 pandemic evolved from March to today, from your perspective and from a health equity lens?
Sure. I'll start probably a little bit before that. I'll probably start in January because in my position, I sit in the Secretary's office, and so we have meetings on a weekly basis where we discuss pretty high-level things that are happening nationwide. And so before March, we were having conversations about the possibility of this novel virus, and we were hearing what was happening in outside of the United States in relationship to the virus. And so we were in preparation for the possibilities of what could happen. And so we moved from January to February, and we're still having conversations, and we are doing what we do in public health. We are surveilling, we are paying attention, we are having discussions, we are monitoring. You know, we are following our public health principles. And so towards the end of I believe February, probably 14 days after Mardi Gras, that's when we start to, I think that's when we had our first case. Um, and that's when things started to snowball. And so we had been in conversations and had been in planning for COVID-19 for a minute. And so while this is happening, while these conversations are being had, I'm also noticing, as the person who is responsible for health equity inside the state, and also responsible for a person who is African American, I'm also hearing inside the African American community that, you know, African Americans believe, jokingly, I'm hearing a lot of people saying, you know, this is something that we don't have to be concerned about. And this was something that I brought up in a staff meeting at one time, that you know, we need to be, you know, doing our due diligence to inform citizens about this illness, the severity of it, and letting them know what we're hearing, what's happening outside of the United States. Because at the before March, the data we had indicated that, you know, as related to morbidity and mortality, death and illness, um, the individuals who acquired it had underlying health issues like hypertension, obesity, diabetes, kidney issues. And so inside America, you know, those are issues that, you know, across all racial lines, many Americans are affected by. But when you look at the African American community, uh, African Americans are disproportionately affected by it. And so, to answer your question, we were preparing, we were hearing, and when things started to happen, we responded, and we were prepared. And so, 14 days after we had our first case, we were developing messaging and getting things in place as best we could with the resources that we had to protect the citizens of Louisiana. And particularly as it relates to health equity, we were also, the governor charged or developed the Health Equity Taskforce, of which you and I are members, to look at how we could help to mitigate what we saw, what was happening inside the state. Because I believe at that time, around April, we saw that disproportionately, African Americans represented about almost 70% of the individuals that who had died of COVID, and we only represent about 32% of those who are living inside Louisiana. So we were disproportionately affected by COVID. And so that was quite alarming, given the fact that we only represent 32% of the population. And so we were doing our due diligence to protect all Louisianans, but those who were disproportionately affected, we were definitely trying to make certain that we were getting the message to communities, and we were getting resources to communities to protect communities.
Thank you for that. Yeah, I mean, it was really stunning, I think, for people who aren't physicians at that time, to really start getting the information about not only how many cases there were in the state and how full the hospitals were and what a huge crisis it was, but then as the data started coming in, and I think you're right, it was like late March, sometime in April, when we started to hear what a huge proportion of the people who had passed away, who had died from the
Yeah.
virus, were African American. It was just staggering.
Yeah.
And so I had a lot of conversations with people, with my students, with my colleagues, about what might be causing that. And one of the things that I had seen early on and had been concerned about, I had a conversation with a neighbor of mine across the street who's a nurse, and he said he was working in a COVID unit, and all the information was coming in from the CDC about the comorbidities are diabetes, hypertension, high BMI, potentially asthma, all of these things. And he said to me, and I thought the same thing in that same moment, he said, this is what people in Louisiana have, and especially the African American community. And he
Yeah.
was just incredibly worried. And that was like mid to early March, or probably
Yeah.
mid-March. And so, now that we have the data, now that we know what happened during the first huge surge, and we have all that information, I'm wondering, what factors do you think had contributed to this health equity issue with COVID-19 in Louisiana? There were people of all ages who were affected by this, largely African American people who passed away. And what do you think were the issues that led to that huge
So
disparity?
let me first say that early on that the elderly, people who were 65 years and older, individuals who had underlying health issues, were individuals who were disproportionately affected, and African Americans. But to answer your question, uh, what racism has a part to play in everything. It always does. We do not like having the conversation about racism. And when I say racism, I'm talking about how racism has affected how we care for people, how we prioritize resources to people, how we prioritize how communities have been created, how communities are whale resource versus not having the resources that they need. And so from that, and in the history that we come out of, COVID-19 was able to come into an environment where chronic illnesses were already disproportionately affecting minority populations due to social economic factors, due to the social determinants of health. And those social determinants of health have a significant relationship with racism across the board. And so for me, social determinants of health, the biggest one was racism. And particularly when you look at how things historically have been resourced inside America, or in the communities that we live in, and how that has, as a result, affected how people eat, how people live, how people pray, and how people play. And so, and where people live, and the resources that they have inside their communities. And so, we are a product of our environments, and the environments in which we come from are affected by the policies that we make, and they are affected by who gets priority versus who doesn't get priority. And so I believe, I tell my students this all of the time, the health inequities and health disparities that we see happening inside our communities, they are not a natural phenomenon, not at all. They are a product of the systems in which we live in. And so COVID-19 was just able to take advantage of what was already happening. And so it just provided another medium through which we were able to examine inequities inside our society.
Yeah, I
So
think that's such an important,
yeah,
I'm sorry, go ahead.
it just it provides us another lens to see inequity,
Yeah.
and it provides us another lens, another opportunity to do something about it,
Yeah, I think that's That's a great way to think of it. And, I think it's so important that you talk about policy, and that it was, to be very clear that it's not some sort of natural phenomenon, it's not some sort of genetic phenomenon, that these are policy decisions that were made across many sectors that resulted in these realities that we saw already with health inequities, that then, like you said, I think I love the way you said it, just allowed the virus to take advantage of those existing health inequities. Yeah, I think that's so important. One thing I'm interested in, and especially since we've been in this world we're living in with COVID-19 since March, I mean, since January, February, March, and now we're seeing another surge of it across the country and across the
Yeah.
world. What sorts of interactions have you had with both residents of Louisiana and also health practitioners about the pandemic? And what sorts of conversations are you having about health equity around the state during this time?
So what we are preparing to do inside LDH is to make certain that people still understand, despite the fact that we are in phase 3. And I do believe that Governor Edwards has provided us a pretty solid plan that has guided us through this point, because when you look at what's happening inside the other states surrounding us, they're not doing as well as we are. We want to do better, but they're definitely not doing as well as we are. And so we are having conversations that continue to stress the importance of masking up. We are having conversations that continue to stress the importance of being physically distanced from individuals, socially distancing oneself from another person. We are having conversations that stress the importance during this time of Thanksgiving for people to be very creative and really not go outside their social networks and visit families at this time, because we want to be diligent about mitigating the spread, because what's happening around the nation is community spread, where people are going out and about and spreading the virus. And so we're continuing to share those key and very important and very simple points. Mask up when one goes out, continue to social distance, continue to wash one's hands, continue to sanitize one's hands. And continue to think that, a lot of people, a significant number of people may be asymptomatic and not become severely ill. However, those individuals can transmit the virus to someone else. And so those individuals that they transmit it to may become severely ill, may die. And so we're wanting to, while stressing the significance of masking up and stressing the significance of social distancing, we're wanting people to understand and getting them to understand that, think about your family, think about your grandmother, think about your mama, think about your papa. We're really wanting young people to really think about this. Because there was a time when a lot of the social spread and possibly some of what we still see community spread has to do with young people just being out and about. And so making certain that young people, all of us get that message and are sharing it. And also we are spending a lot of time preparing for the coming vaccines, the COVID-19 vaccines. And so I can't share a lot about that now because that information is being prepared, but we are in the process of preparing communities for messages so that, when those vaccines are available, we want communities to be able to utilize them. And because it's another tool in our arsenal that can help us to get to back as close as back to normal as possible. So we're had to answer your questions. We're having conversations about continuing to share messages of masking up. We're continuing to have conversations about social distancing, and we're adding to that now the conversation and plans around COVID-19 vaccines.
I want to pause here and say for all the attendees in the audience, if you have a desire to start typing questions into the Q&A, if you have them in your mind, go ahead. and we'll address them after we finish our conversation. But if you have questions on your mind, just go ahead and start typing them into the Q&A. The chat, I believe only the panelists can see, and we can see the Q&A as well. So just go ahead and start
And
typing
Amy,
your
let me
questions.
add to that, because you and I are both on the governor's health equity, COVID-19
Yeah.
health equity task force. In sharing and preparing, I will say this, in preparing for the COVID-19's vaccine, we have to be, and this has come up, particularly as it relates to African Americans. There are a lot of things that have happened to African American communities. And so we have to be very diligent in sharing information in a culturally sensitive, respectful manner, and also share as much information as we can to mitigate some of the uncertainty around those vaccinations. So we must, people have a right to feel concern about vaccinations. I understand why they feel concerned. People have a right to be worried about them. But I think, there's a way for us as helpers, you and I as helpers, and those of us in the public health sphere, to mitigate some of that by as telling the truth, telling the truth and sharing as much information as we can, and letting people know, this a vaccine is much like masking up, much like social distancing. It is one of the tools in our arsenal to protect ourselves against COVID-19, and it's something that we can use to get us back to normal.
Yeah. Thank you. There's actually a question in the chat already that's very similar. That's very close to that topic that I'll ask you in a couple of minutes when we're done with the other questions. So all of that is very much on people's mind. So one of the things that you and I, as members of the Louisiana Governor Edwards COVID Health Equity Task Force, we were kind of tasked with coming up with recommendations for change. And so I'm curious, from your position, what measures do you think that we can really take, like practically take as a state to address these health equities that already existed, that enabled the virus to take advantage of them now and into the future?
So I'll talk about the two that I have a direct part to play in. Well, I'll talk about three, and I'll start with the third one, and it's still being mapped out. I think that there's an opportunity for us to collect better data.
Yeah,
I think there's an opportunity for that. I mean, you said on the board. I mean, there were just some opportunities. There's some opportunities out there for us to do a better job to collect better data so that we can respond more effectively and more efficiently. So I think that the task force can help to do that. So that's one thing. The other thing is on the task force, I was on the health equity dashboard, and so we made recommendations for the development of a health equity dashboard, which is happening inside the Office of Public Health. They've developed the health equity dashboard, and so that should be coming it is coming to fruition, and that dashboard is being developed, and it will allow us to look at health equity data region by region, down to the county, parish level, and zip code level around the state, so that we can look and see what issues are in the state, where we can look at job information inside the state. We can look at prison information inside the state. We can look at a number of social and economic factors inside the state so that we can better plan around what we need to do in certain areas, in the areas inside the state as it relates to improving wellness and health. So that's something that I think is definitely that is shaping up and coming out of what has happened with COVID-19 in the state. The other thing is and this was kind of happening while we were in the health equity planning process, one of the groups, and this is Dr. Gee's work group, I can't remember the name of her work group at the moment.
That was the one, That was the one I was in. It was, it was I think it was addressing health disparities. So
Yes.
yeah.
So you guys made a recommendation around the development of some sort of training for providers. And so it's quite interesting that you guys were doing that while at the same time in the legislature, the summer legislature, I believe Representative Hilferty had a House Resolution 33, which deals with implicit bias, and it was tasked with my office to develop curriculum along with the Office of Public Health's Bureau of Family Health. We've been working together with them to outline curricula as a standard, LDH as standard, and use this curricula to give to healthcare providers, credentialing organizations around the state to say, hey, here is the standard, use the standard as you see fit. So I think for me, those are three things that I think are going to come out of the health equity plan. Much more, but three things, given my purview, are going to come out. I think that, you know, there's a possibility that we can push to collect better data so that we can respond more adequately. That's an opportunity. The third one is we're going to be developing a health equity dashboard so that we can know real time what's going on inside communities. And also one thing that I'm hoping that will happen inside these dashboards is we'll be shopping that around communities. So communities will be teaching communities how to use that dashboard so that it's just not a dashboard that just exists, but we want to build communities' capacity to use the dashboard so that they can say, okay, I want to know what's going on in my community, but I also want to know what I need to do with this data. So that dashboard is going to be there, but we're going to have resources to help build communities' capacity around that. And two, we're developing a curricula that will be developing, that will be updated on an annual basis, and it will have its own advisory council where experts from around the state will be added to it to update it on a regular basis, provide technical assistance on a regular basis so that healthcare providers are knowledgeable and have ongoing information about implicit bias so that they can improve their quality assurance as it relates to their encounters with their patients. So those are three things that I think from my purview that will come out of the health equity.
Yeah, thank you. And I'm so glad that you highlighted those recommendations around implicit bias, because I think it's something that's really well known in professional and scientific and research communities, but not something that people have personal experience of it, but I feel like it's not discussed enough out in the world every day. And I even had a physician I was talking to was telling me he felt like he didn't understand. We were talking about the issue of class versus race, and kind of going back to what you said earlier about racism. He's, you know, and I said, well, there are all these studies about how implicit bias about race, and how people of color and African Americans in specific receive different medical treatment based on this implicit bias, that, you know, physicians don't even realize that they're treating people differently because of their skin color and their ethnic background. And this doctor I was talking to said, well, you know, it's such a mystery to me because this African American man that I was treating was so sick and he's incredibly wealthy. And I said, it's known, it's already been researched that this is decoupled from wealth, from class, you know, and this is something I think that we don't talk about enough.
I agree.
Yeah.
It's quite fascinating to I tell my students sometimes, you know, one of the most educated populations inside the United States, subpopulations inside the United States, is African American women. And yet when you look at their health outcomes, you find that white women who didn't finish high school have better health outcomes than many of these women. And so what is the issue? And racism at its core is it. And so that's, you know, that's difficult for some people to understand. And so, but it is what it is. And so until we're able to understand that, we're going to still be where we are.
Yeah, no, I think that's a really important conversation. So my last,
the other thing
go
is,
ahead.
you know, people what people don't realize is that your values, attitudes, and beliefs will always rise to the occasion.
Mm,
And
mm,
so, what you've been taught about someone,
mm,
what you've been conditioned to believe about someone,
mhm.
just because you're in a
Yeah,
certain profession,
yeah,
or just because you believe I'm so and so and so and so, they don't go away unless you've dealt with them
yeah.
because they're very involuntary.
Mhm.
They're going to happen. So if you haven't dealt with the fact that your community has taught you to believe that you are better than this person because of X, Y, and Z,
Yeah,
or that this person is meaningless for X, Y, and Z, you are going to exude that if you haven't dealt with it. But a
yeah,
lot of people think that, well, the professional in me is going to be able to not deal with that. No, you're not if you're not dealing with it,
yeah,
because it's gonna bubble up. It's who we are as human beings. It's human nature. I mean, and you know, you can see it across the board, whether you're dealing with racism, whether you're dealing with homophobia, whether you're
yeah,
dealing with misogyny. I mean, what you think about people, it always bubbles up if you have not dealt with your issues, values, attitudes, and beliefs. If you haven't dealt with them, they're going to always bubble up. What you think about someone, they will bubble up.
yeah, that's right. And um, I mean, by definition, that's what implicit bias means, right? I mean,
Yes,
exactly what you're talking about is this is not something that you explicitly think you believe or something that you
yes,
explicitly think you're doing. It's something that you do without thinking about it,
right,
you know,
right.
unconsciously. So my last formal question before we get into some of the Q&A is, we heard a lot in the spring about the kind of the devastating personal impact that COVID-19, well, we've heard for months about this, that COVID-19 is having both on survivors, on people's families who passed away, devastating mental health impacts on providers,
Mhm.
physicians, nurses, hospital staff. And I imagine that you being in your position in the state, that it's been a roller coaster for you as
It is.
well. And so, you know, I wonder, my last question is, what are some of your own personal and professional reflections about this pandemic, especially in Louisiana, um, starting in January till now?
You know, when this first started to happen, my spouse is a therapist, and they indicated that it felt like because you saw a person one day and they weren't here the next day, and that
Mhm.
was so frightening. And they indicated that it was kind of reminiscent of HIV, and so it was just uh, not the same, but the same in the sense that you had nothing else to compare it to, because
Yeah,
it was a novel disease, and it was like,
yeah,
I just saw this individual,
yeah,
and they just had they couldn't talk a little bit, or they couldn't breathe a little bit, but
yeah,
and so it was just very, very frightening. And so it has been overwhelming. During this time, I've had three family members who have succumbed. My brother has died.
I'm so
I had
sorry.
a cousin who has died a few weeks
Mhm.
ago. My father died at the beginning of this.
Mhm.
And so
Mhm.
it has been a bit overwhelming.
Yeah,
It has changed. It has changed the way we lived our lives. I mean, all of us. I
yeah,
mean, we will forever remember this forever. I mean, you know, my grandmother talks of when of what was that the catastrophe of the 30s and 40s when Wall Street
oh, the depression.
the
Hmm.
depression, and she said the
Hmm.
only thing that she remembers it. She said the only thing they lacked was sugar, but
Hmm.
she's from the country, but she remembers that and she remembers the '60s and the social unrest and racism and those things of that nature. And so this will be one of those times. Along with the other racial strifes that I remember as an African American, but this will
Yeah,
definitely be just one of those times that um, everything changed in the world.
yeah,
You have a new novel virus and it changed the way that we live. And yeah, and it's interesting what we will learn, what we will learn, continue to learn about the virus from years now,
That's right.
because we're still learning things. And so
Mhm.
it has been devastating, not only for myself, but just for a number of people. And
Yeah.
um, but I am so honored to work with my public health brothers and sisters and healthcare brothers and sisters who have gone above and beyond to protect people's lives and to be there for community and to support community. You know, we are all we have. We are all we have, and so
Mhm.
I, 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 you know, one, I am optimistic by how human beings come together and support one another during
Mhm.
these times, and so
Mhm.
that has me very, very, very optimistic.
Mhm.
But these have been some very trying times.
Absolutely. I'm sorry for your losses. Um, so let's turn to questions. And if folks in the audience or in the attendees, if you still have some questions, type it into the Q&A, please. I'll start with this one really interesting question from my close colleague and friend, Angela Chalk, who's attending tonight. And she said,
Hey,
how does
Chuck.
one, everybody knows Angela. How does one in the African American community overcome the skepticism of vaccines?
Oh, that's going to take some work.
Mm.
Um, that's going to take some work, and that takes work for years to come, because that's going to take some work.
Yeah, yeah.
Yeah, that's all I can say with that. That because a lot of things got us to this point, and so that's not going to happen overnight.
Mhm.
And so you have systems in place that have contributed to misinformation, mistreatment, discrimination, hurt, harm to marginalized communities over long periods of time. And so it's going to take long periods of time for that to be undone.
Yeah.
And so I am hopeful that that can be undone, but there has to be a lot of intention, good intention, on the behalf of those of us in power to make certain that we do our part, our due diligence to inform the community with all of the information that we have. And so I can assure people that when I am in meetings and when I am talking to people about sharing information with communities, that I am coming to the and my colleagues as well are coming to the table saying we need to inform the community with all of the information, not just bits and pieces of the information, because what we don't want to happen is for us to say, hey, this is what we have, and we missed an opportunity to tell all the truth, and then 6 months
Mhm.
down the road we say, oh, but we didn't tell you that portion of it.
Mhm.
We didn't think it was important. And so we want to make certain that we do our due diligence to give people all of the information up front to say, okay, this is all of the truth. And
Mhm.
so, yeah.
Yeah, it was interesting. I mean, I think that's such a great question. Somebody else in the audience said that's a deep question, which it really
Yeah,
is.
that's a real.
It is. And one of the things we spent a lot of time talking about on my subcommittee of the governor's task force was trust and the lack
Yeah.
of trust, which for very good reason, which is, what we're talking about really. So another question that somebody had is about how difficult it's been mentally that you were just discussing in terms of mental health and just emotional issue, how emotionally and mentally difficult this has been. And they say, I live in New York City and we're possibly going into another shutdown. I've lost people in the first few months, which was very difficult. And my fear is experiencing that again. How do you think we can better prepare mentally as a nation, as many of us are going back to work or working remotely, and the length of this pandemic is uncertain? Um, so like, how do we prepare for this unknown future as we continue?
I think that we have to be honest that there is still just a tremendous amount of uncertainty. We can't. one of the good things about being married is my spouse is a therapist, and so I get all these little nuggets, and so that help to so that I can protect myself, mitigate my harm, protective factors. And so we have to understand that, there is a tremendous amount of uncertainty. And so we have to still establish routines. We have to get up every day. Every day I've been working from home for the last since March. So I get up every day. I get up at 6 o'clock every day. I come down to my office downstairs. I start my day. I answer my emails. I get in my routine. I only I don't like to overwhelm myself with a tremendous amount of negativity. And so I would encourage people, to the person who asked that question, I would encourage people to understand that there is going to be some uncertainty moving forward, because we there's so much we don't know at the present moment. But there are things we do know.
Mhm.
There's so much we don't know, but there are things we do know. We do know that you can protect oneself against a COVID-19 by masking up and social distancing. We do know that that uh, um, vaccines are coming. They are coming, and we know that uh, they're showing positive signs that they're being effective. I think one the other day was 90% effective, and I believe one a few days ago was showing to be 90% effective, and I believe one I saw yesterday was 95% effective. And so
Mhm.
there are factual things that we're seeing. We also can get in a routine so that we can develop some sense of normalcy, so that
Mhm.
we can keep things moving and keep things going, and so that we can have some sort of normalcy in our life, because we're not going to get back to normal for a minute. We're just not going to
Yeah.
get back to normal for a minute.
Yeah.
And one of the things that I did during, you know, uh, just I kept a lot of the negativity out of my life. Yeah,
Yeah. I think
I
that's
try
really.
as best to keep the negativity out of my life, and I compartmentalize sometimes too well,
Mm,
sometimes too well. I
yeah.
can choop, choop, and put it over there.
Yeah. It's necessary, but can be problematic for
Yes,
sure.
it can be.
Yeah, definitely. Um, so one person is wondering if you think we'll go into another lockdown soon, the country or the state. It's hard to say.
I don't know.
Yeah,
I don't
yeah,
know.
it's hard to say. And then I think this will be, if anybody else has any other questions, you can type it in. This will probably be either our last one or almost our last one. What do you think? And I know, I mean, the Louisiana Department of Health, your entity is going to be responsible for trying to figure this out, I'm sure. What do you think is the most effective way to administer the vaccines to ensure we're all protected? Do you think it'll end up being mandatory? What do you think about that?
I don't think it will end up being mandatory. I don't think that that's going to happen. Um, I think that it will be a phased approach. It will be the probably a three-phased approach. Those who are working in healthcare or EMTs will probably get the vaccine first. Then those who are working in prevention healthcare settings will probably be second, and then those of the general public will probably be third.
Mhm.
But I don't think um, I don't no, I don't think that a mandatory vaccine is what is needed, and I don't think that that would be effective. I think we just need to get to herd immunity, and I
Yeah.
think that the best way for that is to be voluntary. And I think as long as we are doing that, we are masking up, we are social distancing, and those who are needing wanting the vaccine, get the vaccine. We will get there.
Okay, I think this will probably be our last question. It's a great one. There's a physician in the audience from Biloxi who asks, since April, Nova Scotia, Canada, and surrounding provinces totaling more than 1 million people have had 20 cases and few deaths. They have a fair Afro-Canadian population and no lockdowns. What did they get right? Are you familiar with this case, and do you have any thoughts about that?
I don't know enough information about
Hmm.
that. I don't know
Hmm.
enough information about that.
Yeah, it's interesting. I mean, Nova Scotia, the only thing I can think of, and I'm not a physician and I'm not familiar with this either, is having spent a fair amount of time in Canada and having been through Nova Scotia, I wonder if maybe there's not as much of a density of population in some of those provinces.
That's what's popping up in my head. It's like
Hmm.
they probably don't have that density.
Hmm.
Probably don't have that density.
Yeah, I mean, I know the largest, I think the largest city in Nova Scotia is Halifax, but it's not a very densely populated, I don't think a very densely populated province. So that may be some of the reason, is the first thing that I have in mind. Um,
That's what popped into my head too, but I don't have enough information on that. So, but
yeah, yeah. Well, this has been a really rich conversation. I can't say enough how honored I am and pleased to have had you speak with us tonight. And I want to thank you for all the work you've been doing. I did first meet you. I've only ever literally seen you on Zoom, and I did first meet you with the comments you've made on our task force for the governor, and it's been just wonderful getting to know your work. So thank you so much.
thank you,
Yeah,
Amy. Thank you so
yeah,
much.
you're
Thank you so
welcome.
much for the invite, and thank you so much
Mm,
for just asking me because I
mhm.
was, as you know, I mean, I was like, I don't know, but I mean, I really enjoyed this, and I love this format. And thank you,
Yeah,
thank you, thank you. I really appreciate you taking the time to invite me, and even just having this discussion,
yeah,
and having it in this format. I think
yeah.
it was
Thanks.
more effective than anything that I've done in a minute.
Well, that's nice to hear.
And then the timbre of your voice is like so soothing.
Uh, people tell me that all the time, and I wish I felt as soothed by my own voice as others do. But I'm very glad to hear that. I want to thank everybody that came. We had about 30 people come total, and that's really wonderful. I apologize. I think I had gone in and out. I think we had a little bit of a glitch at the beginning, so I'm sorry if folks were waiting a few minutes, but thank you so much.